Thank you for joining us this evening. I'd like to thank World Vision for having Save the Children on this panel. As Carl mentioned, my name is Nicole Richardson. I'm the program coordinator for the Hilton Initiative, as well as the quality improvement specialist for orphans and vulnerable children at Save the Children. I'm actually presenting tonight on behalf of my colleague, Kendra Blackett-Devinga, who's our senior technical advisor for orphans and vulnerable children. She unfortunately was unable to make it tonight. So I've been asked to give a broad overview of some of our large-scale OVC programs in Ethiopia, Uganda, and Mozambique. So to start, Save the Children's OVC programs at a glance. Basically, we focus on community and government system strengthening, advancing the state-of-the-art in nutritional interventions for HIV infected. We focus on community-based management information systems, as well as early childhood interventions. We also have done implementation through partners to achieve scale. Our OVC programs began in 1995 with the COPE project in Malawi. Later, this was evaluated as one of the most sustainable community-based responses to OVC care and support, as it was known as the test of time. And we're currently implementing large-scale service delivery OVC projects in the Africa region through our International Save the Children Alliance. So what is Save the Children's contributions to the evidence base? Our programs have informed key strategies, including really how to care for child carers. This was based on research in Uganda, Tanzania, Zimbabwe, and Angola. Really the value of keeping children in communities as opposed to institutions, which came out of the First Resort series. The use of community-based management information systems to improve the overall well-being of OVC. And this came out of the Joint Learning Initiative on Children and HIV/AIDS report. And I just wanted to highlight here that I did bring the summary of the report that was over there. And if there aren't copies, I can, if you come and talk to me afterwards, I can get you a copy of that. And we're also currently doing a study on child protection in Asia, which is in a lower prevalence context. Our other programs are in very high prevalence HIV context. So what do we know? All children need some degree of the following: care and protection in a family environment, access to basic service and support such as education, health, nutrition, legal, and welfare, psychosocial support for children as well as their caregivers, especially children 0 to 8, improved capacity of households fostering children to cope economically with additional family members. For instance, economic security has a direct impact on protection, ability to attend school, and meet basic health and nutritional needs, and should not be considered an extra or indirect support. And also what came out of our findings of the Quality Improvement Pilot Project in Ethiopia is really that an age-specific and developmentally appropriate responses is really needed. A 3-year-old orphan needs something quite different than a 14-year-old orphan, and this is just the breakdown of the percentages of OVC at different ages. So where are we now? We know that less than 10% are receiving assistance from agencies beyond their extended family, neighbors, communities, and churches. The majority of care is provided through local approaches based on the ability of family and community safety nets, but this capacity is really being threatened. There's still a heavy resilience on volunteer-based efforts, although now changing emphasis on parasocial workers. And groups are now starting to focus more on quality. This grew out of the Care That Counts initiative, which is managed by the University Research Corporation under USAID. Sustainability remains challenging, and civil society and communities are overstretched, requiring new partnerships with governments and the private sector. So now I'll go over a broad overview of our large-scale programs in Ethiopia, Mozambique, and Uganda. Now, the Positive Change Children, Communities, and Care Project is known as the PC3 project, and it works with World Vision, Project Concern International, Save the Children, World Learning, and Family Health International. It's a 5-year was a 5-year program and a $20 million project. It was a tiered partnership going from the INGO level to the LNGO and local NGO level, as well as the community-based organizations. It has reached over 500,000 OBCs across 7 regions in Ethiopia. Support to this project provided support to the National OBC Task Force to coordinate policy. It's coordinated and comprehensive support in areas of education, life skills development, livelihood, psychosocial support, health, nutrition, and protection. It also has used the Child Status Index as a case management tool and has used the quality standards to monitor improvements in child well-being. And I'll go into a little bit more on that. It is used an ages and stages approach to programming with specific interventions for early childhood through scale-up of their center-based care. They've also done pediatric case findings within these ECD centers. Lessons learned is the local NGO capacity building and the transformation for traditional groups called ITERs into leaders for OBC care and support. And they've also now just come out with a tool called the PC3 Toolkit for implementation for OBC programs at scale. So that's available. As far as Scale Up program in Mozambique, this is really a partnership of Save the Children US, Save the Children Norway, and Sweden, as well as with the Hope for African Children initiative. It serves over 35,000 OBC with a comprehensive range of services. It's implemented in the southern and central regions of Mozambique. This program uses youth as a home-based care providers and mentors for younger children. Their support for wraparound programming to meet comprehensive needs through partnership with WFP, PCI, and the Right to Play. And also support to early childhood development programs targeting children affected by HIV through ECD centers. And I was able to go to Mozambique a few months ago and really see the connection with early childhood development and our OBC programs, which was very promising. So now for Capacity to Care project in Uganda. This project focused on really local government systems strengthening to support and coordinate OBC response. This really serves as an extension of the Ministry of Gender, Labor, and Social Development. It was implemented in the central region, and the major lessons learned in terms of coordination was really to support the local government capacity building, how governments and civil society can work effectively together. So some of the highlights and successes from these 3 programs have really been the massive mobilization and establishment of large network of civil society organization and government to support OBC in Ethiopia and Uganda, coordination of OBC activities nationally to ensure quality as well as standardization of services. The PC3 program was evaluated as the most extensively united OBC partner network in any African country, and the extensive capacity of civil society organizations at community and national level to implement OBC work and monitor and evaluate their own successes. And this really came out of our Ethiopia project under the PC3 program, where we piloted the national level quality service standards at the point of service delivery. Some other highlights and successes were able to foster innovation and field-based learning, communities of practice, promising practice more easily taken to scale, such as nutritional support, savings group, and protection, mobilization, leveraging of large amount of resources to support OBC, including linking with the Clinton Foundation for Plumping Nut, and this came out of the PC3 program, and able to get resources out to many smaller organizations in a concentrated period of time and increase accountability. So some of the challenges and lessons learned, as I mentioned, PC3 was really a tiered structured approach, and so a tiered structured approach, the capacity building takes longer to implement, but can be more sustainable once local NGOs have the skills, materials, and approaches they need to continue. Assertive capacity of local NGOs and community-based organizations is still a concern. Continued capacity building and continued support to diversify research space are required. Some settings are more successful than others. Partnership with government is critical for sustainability. Taking OBC work to scale requires strategic and large-scale networks. With effective support, communities can mobilize resources, identify and care for children affected by HIV/AIDS in a sustainable way. So now here I'd like to talk a little bit about our other initiatives that we have been working on. We're building the capacity of local groups to implement quality standards to improve overall well-being. This was done under, as I mentioned earlier, under the PC3 program. Save the Children partnered with the University Research Corporation to develop and test the use of quality standards to improve the overall well-being of the community's response. We worked with all the way up from the national level, Ministry of Women and Social Affairs, and to come up with a national level service standards, and then with the critical minimum activities, we pilot them at the point of service delivery with quality improvement groups to see if they were doable or not. And these were actually launched in February at the national level. So they're the national level program quality standards for orphans and vulnerable children in Ethiopia. As well as another initiative that we're working on is promoting an ages and stages approach to programming for children affected by HIV/AIDS. And this is coming out of a new initiative called the Hilton Initiative. It's a joint collaboration with Care International, Save the Children, and the Consultative Group on Early Childhood Care and Development. And under this initiative, the main objective is to develop an essential package for young children affected by AIDS. So we are focusing on the age group conception to 8. And the essential package will be devised of 3 separate components. The first is the rationale for mainstreaming ECD into OPC programming. We're right now working on an in-depth literature review as well as a program review to inform the second part of the package will be the ages and stages actual standards. Then the third section of the essential package will be a toolkit. It'll be at 3 separate levels, the programmatic level, as well as the volunteer level, as well as the caregiver level. So at the volunteer level, really be focusing on the job aids that can support the standards, that if you reach these standards, you're doing good enough quality, as well as at the caregiver level, we'll be doing job aids. And that's just kind of in development. It started in October of last year, and we're currently in the development phase of the essential package. We're actually hosted a meeting for field practitioners next week, and so validation will take place next year. So takeaway messages is really, we need to continue to build resilience of families and communities by building household capacity to cope and ensuring economic safety nets. We need to build systems of social welfare and social protection at country level and target assistance to those who simply cannot work or meet needs. Need for improved coordination at the program and donor levels. Need to find ways to consolidate our expertise to ensure that programming responds to the changing realities on the ground. And more effort needed in research and evaluation of OBC programs so that we know what is actually working at the point of service delivery. As recent reviews noted that not many OBC interventions has actually been evaluated. Thank you. Do you have any?